Hi there, my name's Kenneth Fleming. I'm the Head of Health and Safety for Greater Glasgow and Clyde. I want to speak to you just for a couple of minutes about health and safety incident reporting and the use of DATICs. Most of you will be really familiar with the use of DATICs, but what I want to talk to you about is just the importance of reporting as quickly as possible after an incident occurs. We use DATICs all the time to look at the range of incidents that happen across the organisation. And one of the things that we need to look at is RIDDOR incidents. Most of you will have heard about RIDDOR incidents, and that's where we need to report to the Health and Safety Executive because somebody's had a major injury like the break of a bone, a fracture, or they've had an amputation, or they've had something splashed in their eye and they've lost their sight, or they've been off work for more than 7 days because of an incident at work. And we have to report these incidents to the Health and Safety Executive, some of them within 10 days and some of them within 15 days. So the key thing is it's really important that we get incidents reported as quickly as possible, because we are then going to have to report to the Health and Safety Executive within those 10 or 15 days. So it's really critical that you report incidents to us on DATICs, preferably within 24 hours of the incident actually taking place, and that will make things much easier for us, both in investigating the incident and also making sure that we can report to the Health and Safety Executive. So that's the critical thing about incident reporting. And obviously if you don't report incidents, we don't know what's happened, and so we can't do anything about it. So it's absolutely critical that you report, and you report on time. The other thing that I want to speak to you about just very briefly is about needlestick incidents, and we've been doing a bit of focus over the last 12 months on the reporting of needlestick injuries to staff, and also we've changed a lot of the devices that people use for taking blood, for giving injections, for giving insulin, to safety devices. So most people should be very familiar with the range of safety devices that we are now using across the organisation, and these are designed in order to reduce the likelihood of staff getting a needlestick injury. So one of the things with all these new devices coming into play now, one of the things that we need you to do is when you're using these devices, if they don't work properly, or they fail, or they don't activate properly, you report that to us on DATICs as a needlestick incident. It won't necessarily be an injury, it might be a near miss or just an incident. But if you report these to us, we can then make sure that that's investigated in case there's a problem with that particular type of syringe or that type of device. We can go back to the manufacturer and make sure that it's fixed in case there's a fault with them. So we need you to tell us if that happens. What we don't want is you just try one, if it doesn't work you throw it away. We need you to report that to us, because we'll then go back to procurement and they'll chase up the manufacturer to make sure that it's not a product with the actual device. So any issues with these new devices, you'll all have seen them, please report that to us on DATICs and then we'll follow up. Thanks very much.